Some 17,000 migrant farm workers from Florida, Texas, California, and countries like Jamaica and Mexico pass through Connecticut each year, helping tobacco and fruit farmers harvest crops. Most have no access to health care. A team of students from around the state who plan to enter the health professions try to bridge that gap each summer by offering the migrant workers free exams and medicine right at their work sites. Quinnipiac University physician assistant students Kelly Slauson and Michael Turk were among 21 PA students who volunteered at the summer 2009 clinics. Here they are pictured at a tobacco farm in East Windsor.
Kind of problems that they have are some really common problems, it's high blood pressure or, diabetes, but then they can also have some, unique kind of more urgent kind of matters, whether it's a, injury from a trauma or something that happened while they were in the field.
Lack of benefits, transportation, and sick leave pay are among the reasons migrant workers do not seek health care. Kathleen Swift, a PA student who graduated in August with Slauson and Turk, explains why the clinics are successful.
Quinnipiac and the Yukon Migrant Farm Workers Clinic brings the health care to the farm so that they don't have to go anywhere. They can walk over after they're finished with work, and it makes it more accessible for them to obtain the health care.
The PA students from Quinnipiac are a vital part of the medical triage team that includes physicians, students from the University of Connecticut Schools of Medicine, Nursing, Dentistry, and Pharmacy, and Yale Medical School. Their work is funded by grants. Swift wrote Quinnipiac's portion of the grant application this year, obtaining $3,750 from the Physician Assistant Foundation.
The students are valuable and critical members of the team, not only because they provide manpower and workforce to take care of those patients, but because of their desire to take care of the patients as well as their essential clinical skills, being able to get to perform histories and physicals, and as well as work on prevention and wellness with these individuals.
In addition to enabling them to practice clinical skills, students say the clinics make them more culturally aware.
Working in more rural areas helps us diversify, so we're working in various settings in healthcare as we would anywhere in the country. And we also get to practice our medical Spanish. And another important part of the Migrant Farm Worker Clinic is that we can collaborate with other areas of medicine, other pharmacy students, dental students, medical students, as well as different doctors throughout the state.
The clinics provide medical services to 200 to 400 patients each summer. Patients may present with musculoskeletal disorders, respiratory and pesticide-related conditions, tick and mosquito-borne illnesses, contact dermatitis, dehydration, and eye conditions like pterygium. What is the role of the PA on the team?
What we do at the clinic is they go through triage.
Do like blood pressure, their blood glucose.
And they come to us with a complaint, and we're supposed to obtain a history, ask all the pertinent questions, and they do a proper physical exam.
And you examine the patient, get their history, and then you come up, you talk with the students and think, what do you think the diagnosis is, make a kind of treatment plan with them, and then you go and present it to the doctor.
Well, we come with a lot of experience compared to some of the other volunteers there, such as the first and second year medical students. We have a full year of clinical experience.
The migrant workers are given free sunscreen, insect repellent, hats, and sunglasses. Condoms also are distributed, as sexually transmitted diseases are a common complaint. Lord, former president of the American Academy of Physician Assistants, explains why.
Number one, you see patients, predominantly men. The migrant farmers tend to have a higher incidence of males, as well as individuals who are away from their homes, many of them away from their home countries. On top of that, there are language barriers and cultural issues and differences, and so it's very important for our students to spend some time with counseling and basic education.
After taking a patient's history and conducting a physical, the PA presents his or her findings to one of the attending physicians. On this particular night, Turk spoke with Dr. Mike Steinberg, assistant professor of internal medicine at Yukon Health Center. Doctor and PA then meet with the patient, and a treatment plan is developed, if necessary. Patients are given free medication for such conditions as heartburn, high blood pressure, diabetes, and eczema. Physician assistant students at Quinnipiac also serve the community by promoting literacy in elementary schools and volunteering at flu clinics and health fairs, but they are especially dedicated to two causes.
One is to help combat homelessness and lack of food and care for our homeless in New Haven. Our students participate in Midnight Run. We've adopted the men's shelter on Grand Avenue to help them with screening, health literacy. Our students are also involved with the National Kidney Foundation in efforts to screen for kidney disease. Chronic kidney disease, though it may not be as glamorous as some of our other medical conditions that we encounter, is a disease that affects millions of Americans.
Slauson and Turk say the clinics give them a chance to practice primary care before heading into the real world.
The way we're trained as PAs, we're really trained as patient advocates too, so I think we kind of bring that kind of aspect to these camps, where we really try to do the best for these patients and really figure out, go the extra step to figure out what we can do for them, because with the limited resources and limited time.
The migrant farm workers will head home at the end of the season, knowing their medical needs have been addressed by caring individuals dedicated to providing access to good health care for all.